All right, well, it's a pleasure to be able to talk to you guys. It's fantastic that you're already members of the IAOMT. I think I'm a life member of that organization, and I think the approach is extremely important. I wish more people were involved. So this is just going to be a real quickie for you today. This is something that takes multiple days to really discuss thoroughly, but I'll give you enough of a introduction that you'll have some idea of whether this is something you want to pursue or not.
Bill, excuse me, it's not in presenter mode yet. So do you
well, what does that mean?
If you
what
go,
are you seeing?
I'm seeing your PowerPoint, but it's in.
Oh, really? Isn't that interesting?
But I'm not. It's not in presenter mode.
I'm seeing this. Let's see. How about new share?
Slideshow mode.
How about that?
There we go. Okay, very good. Thank you, Bill.
All right. Well, anyhow, this is going to be mostly practical. I'm not going to get into a ton of the biochemical theorization here. That's for another time. This was our office in Southern California, the Smile Studio. And we used to have a teaching center upstairs where we did a lot of this stuff, had a very active study group. And then we did courses downstairs. Oh, I should mention this is kind of interesting. That this is a video microscope. I would certainly commend to everyone. They've gotten simpler and less expensive now, but this is a great way to save your back, among other things. So this is our house now. It's called Activated O. Activated O is another name for ozone, activated oxygen, but O is water in French, so it's a bad pun. In any event, this is where we live, and we try and dive every day if possible. Here's my email address. Please stop us during the presentation. I think Barbara can alert me if there's something going on that we need to talk about. I'd rather not just ramble on by myself. My phone number is there. You're welcome to call anytime, along with the email address. And I think Barbara's got that posted in the chat as well. So what is ozone? I think most people, especially if you're in Southern California, are familiar with ozone. We're in Florida, incidentally, now. But what we breathe normally is O2, of course, two atoms of oxygen joined together. But when it's hit with enough energy, like with a lightning strike, it breaks the O2s up into singlet oxygens, solo atoms. And these are extremely reactive. And the thing they're going to react with first, most likely, is another oxygen molecule. So now you have O3. That's ozone. But it's a very tortured bond structure, so that if you look at it sideways, next thing you know, it breaks apart and releases the singlet oxygens again. And that's what goes out and does all the chemical reacting, leaving the O2s behind. That makes sense to everybody. I hope that's clear. Mm-hmm. So that's O3. And if you get in touch with me, I will send you 2 books that will be a good grounding in this subject. The first one is the only book on ozone in dentistry, although it's not real new anymore. We've gone way beyond what Eddie Lynch was able to come up with. But I'll send you a reference to get this book, as well as Velio Bacci's text on ozone in medicine. And if you're interested in the biochemistry and physiology of ozone, these are good places to start. Just request the files and I'll email you. Again, wmdomb@verizon.net. All right, so why are we using ozone? Well, first and foremost, as we knew from decades and decades now, that ozone is the most powerful sterilizing agent we've got. It kills everything: bacteria, viruses, fungi, protozoans, even breaks up prions. And it's hundreds of times faster and stronger than bleach, and does a lot less tissue damage in the process. One of the ways it works is to break up bacterial cell walls. So if you take a rubber glove that's made out of a polysaccharide latex, And if you squirt a little ozone on it, you'll see holes instantaneously. And that's exactly what ozone does to the bacterial cell membranes, and they fall apart and they're dead instantly. So the next obvious question, of course, would be, well, if you're going to do that sort of thing and rip everything to shreds, how come it's not going to do the same thing to me? And the good news is that ozone is actually used by our white cells naturally, normally. And one of the things they do in order to kill bacteria and go after invaders is to squirt a little ozone on them. And so our body is keyed, it's primed, it's happy to have ozone around. Ozone is tolerated very well by the body. And it's removed by natural peroxidases, things that are antioxidants, and most of them come from the cell walls, which has a ton of these antioxidant enzymes in it, like catalase, superoxide dismutase, etc., and the natural antioxidants like vitamin C, vitamin E, etc. So that's how ozone is removed by the body very rapidly. There is no resistance by any critters that we know of to ozone. It kills them too quick for them to develop resistance. And that's why we continue to use ozone with impunity. Ozone is dangerous to a degree. It's toxic or irritating to two tissues in the body, primarily lung and bronchial tissue, and the surface of the eye. And we can actually use ozone gas on the surface of the eye. It stings, but it's certainly possible to use it there. Where you don't want ozone is going down the throat into the lungs. And it will make somebody cough. Then it will make them sock you. You're never going to be able to give anybody enough ozone to do serious damage unless you have them totally asleep and immobilized. There's just no way you can hurt somebody with ozone. You can irritate them and make them annoyed. But that's the worst case. And it happens so rarely, it's almost not worth talking about if you use the technology properly. How do we use it? Well, we stick a evacuator in the mouth. A saliva ejector is fine, a high volume evacuator is fine. But basically what the research shows is that when you use suction nearby, it doesn't have to be absolutely on top of where you're putting the ozone that you can inhale goes to zero. And that's the bottom line. You got to pay attention to what you're doing. And that's why we use the suction here nearby our ozone delivery handpiece, for instance. There are lots of different ozone generators out there. It can get very pricey, but I don't see that there's any need for that. We can go up to 20K for a HealOzone unit, which is where some of the original research was done with. There's a longevity unit for 5,000–6,000, but well, what I'm generally recommending is a much simpler unit that can run about $200. Technically, it comes into the country as a water purifier, but it produces high strength ozone, and does exactly what the other fancier ones do with a proper set of equipment associated with it. And the machines that we're using now are about 30 times more powerful than the HealOzone unit, which means that you can do a lot more rapid treatments, and obviously it's way less expensive. Naturally, we're going to ask, are we legal? And I think that's a reasonable question. And the big issue is, for most people, the FDA. FDA is clueless or won't admit, let's say, that they know much about ozone. They say it's dangerous and has no medical application, which is a complete lie. It's a true lie. And that's what they have on their website. The good news is that there have been some court rulings that say that we as practitioners can use ozone to our heart's content in our office. We can take these machines, modify them for our patient use, and use them without any regulation by the FDA. The one catch is you cannot sell these machines as medical devices from state to state or coming into the country as medical devices, although obviously there's some companies that are doing that. Technically, you can't get away with that, and FDA has raided a couple places. like in California, where they've gone in and seized all the ozone generators. But if you call them a water purifier or a unit to make, let's say, ozonated water to sterilize countertops, you're fine. You just can't sell these units as devices for medical application directly. Now, once you've got them, you can use them to your heart's content with your patients. Well, that's the crazy state of affairs. Now, it could be that a state board could regulate these things, but not one board has chosen to do so. We've had one or two boards, like in Wisconsin, challenge the use of ozone once or twice. We provided them literally stacks of information. And as soon as they saw that, they said, oh, go ahead and go on about your business. So regulation is just not an issue if you're relatively smart about it. Now, safety concerns, I think, are reasonable. But if you look, for instance, at some of the stats, they're quite impressive. For instance, in Germany, one year we had 644 physicians using ozone, mostly for highly concentrated systemic applications. So if you're going to have a problem, this is where you'd really see it. They did almost 6 million treatments that particular year on almost 400,000 patients. And during that year, they reported 40 minor reactions. Nobody croaked, nobody had any serious issues. Most of these are issues like Herxheimer's reactions, where you kill off enough bacteria fast, you're going to react to the broken down cell walls from the lysed bacteria. So that was about, hello, who's beeping? Did I do that? So that's about 0.000007% side effects. And that same year, if you took a look at the stats, we actually killed 140,000 people in the US from properly prescribed prescription medication. So that'll give you a sense of the safety record on ozone. So although we worry about these things, it's really not something that needs to be spending a lot of time in our brains. In the US, for our North American group, we've had 0 suits over multiple decades now, well over 2 million treatments performed with ozone. And that's been for at least 20 years now. You just got to make sure not to do dumb stuff. You can misuse ozone if you work hard enough, but it's pretty hard to actually do any serious damage to somebody. There are workplace standards from OSHA for what you can be exposed to. A small amount of ozone, I think, is probably a good idea in the workplace because it kind of keeps down some of the other crud that's floating around. And if you look at what gets up, even let's say to the front desk from when we're using ultrasonics, it's a little disturbing. And so if you have some ozone floating around in the air, you can keep some of that overspray under control. A lot of people set up ozone generators to run for an hour or two overnight in the office. So they really kind of sterilize the air in the place. Okay, so what can we do with ozone? I'm going to breeze right through this very rapidly. What came up first, of course, with Eddie Lynch and Julian Holmes in that textbook that you'll see, was treating caries. Then they found out that they could reverse caries. Then they found out that you can prevent caries using ozone. And here's a classic experiment. This is 10 seconds of ozone on this soft, rubbery, leathery, sort of an exposed lesion. You put the ozone on for 10 seconds. You bring the patient back in a couple weeks, and the next thing you see is that it's hard and shiny. You can't get a stick with an explorer. That's rock hard. And what we have found is that surfaces that have remineralized like this will never decay again. That doesn't mean the rest of the tooth isn't. Pardon me? Was there a question? So in any event, these areas will not decay again once they've remineralized. And so we call this insufflation, and here we're using a silicone cup splayed over the tooth. Ozone is leaking out around the edge of the cup as we deliver it to the tooth surface. And then, of course, you see the high volume evacuator in the general vicinity that's going to suck up the ozone as it comes out. Flow rate on the ozone generator for something like this comes off of a regulator on an oxygen tank, and it's delivering about 1/32 liter per minute. Compare that to your high volume evacuation, which could suck up a cup of water in a second or two. And that's why if you just have the tornado of the suction nearby your ozone, nobody's going to be able to inhale this, and you can talk, you can laugh, etc. while ozone's being delivered, because the high volume evacuation or even a regular saliva ejector is plenty to dissipate the ozone. Ozone's great under prosthetics, around prosthetics, preventing infection. I'll talk more about perio shortly. Great for desensitizing tooth surfaces in 30 seconds. We use it on aphthous ulcers and abscesses, for lesion trauma, for herpetic infections, and we'll use ozone in lots of different forms: ozonated water, ozone gas, and ozonated oils. Something for hygienists very much so would be delivery of ozone gas or ozonated water by tray to do full arch treatments. Fantastic for pedo. It has pretty much eliminated the need for anesthesia and for having to put kids in the hospital and zonking them out entirely. If these teeth are viable, in other words, the pulps are still alive, you can treat these things in a matter of seconds and shut down the decay process. And as I say, once it's controlled, these surfaces will never decay again. Often we'll have moms actually apply the ozone while we do the suctioning, and we'll send home an ozone tip to practice with before they come in for a week. And so the kids generally have a very easy time of it, and it's a fun appointment instead of a torture session. Here's a quick example. Here, very deep caries, probably right to the pulp. Pulp is still alive, and we kind of scoop out the heaviest blobs of yesterday's lunch, apply the ozone. Notice the bleaching effect. It's lightened up a lot of the gunk that was in there, and then apply usually a glass ionomer. In the space of 5 minutes, you've shut down the decay process and managed not to have to do endo or exo on the tooth. Here's something from Tim Rainey, for instance, saying that since he started in October 2007, when we added ozone routinely to all pediatric procedures, he's not had a single asymptomatic tooth become non-vital because he's been using the ozone. Now let's take a close look at what actually happens internally. Can you guys see the X-ray here? This is very deep caries, essentially right into the pulp. We can verify the pulp is still alive, and that's key. If the pulp is dead, you're not going to bring the pulp back from death. But if the pulp is still alive, I would certainly treat this tooth, and this is long before I would consider doing endo on a tooth like this. Again, scoop out the big blob of junk that's in there. Most of the time, this can be done without anesthetic. Apply ozone. The length of time depends on the clinician's judgment. Normally here, it's going to be several minutes worth because of the depth and the extent of the decay. For most applications, it's going to be 20 seconds or less. So here's the initial situation, and if we bring them back in a few weeks, this is what you'll see. You'll notice the white bridge here. That's tertiary dentin. This is rock solid. Again, that's equivalent to that shiny surface I showed you above, where that surface can never decay again. What's interesting here is you still notice this gray area. That is necrotic dentin that was not able to remineralize, and there's no surprise to that. There's not enough structure left there. That's okay, because now we'll flick out this temporary of glass ionomer, thoroughly excavate this, clean it out very thoroughly. Now we have an exquisite bonding surface here where we can bond to that tertiary dentin with higher bond strength than you can to even enamel. But that takes maybe 3 months while you're waiting for that remineralization to occur. How does ozone do it? Well, if you take a scoop of that gunk out of a cavity, this is what you find when you look at it with nuclear magnetic resonance. All these different peaks are acids: lactic acid, pyruvic acid, butyric acid, propionic acid. All these acids obviously are how bacteria soften up the tooth, at least initially. And when you put ozone on that blob of disgusting acidified soft dentin, what you end up with are two peaks: water and acetic acid, which is very easily washed out of the tooth. And so we've removed all of these acids, which make a happy home for the acidogenic type of bacteria. And so here's the key. If you just kill all the bacteria, you can do that with bleach, for instance, that lesion will be back active with bacteria again in only about a month, month and a half. On the other hand, if you kill a bacteria and remove those residual biomolecules like those acids, it takes over 4 months for the caries to start up again. The colony can be getting back to sitting there making acids. And obviously during that time, the tooth has a chance to remineralize. You have a chance to change dietary habits. You have a chance to change cleaning habits. You have a chance to get some other anti-caries agents on, like MI paste, fluorides, or whatever. And so by the time you get to that 4-month point, that surface is now protected from further decay. Here's how we make ozonated water. Here's our ozone generators up above, a flask here sitting in an ice bath, bubbling ozone gas through the water. We do that all day long, and ozone water gets used for so many different purposes. During COVID, for instance, we had patients rinsing with ozonated water before they even sat down in the chair. And generally, even before COVID, we would have patients rinse with ozonated water for 30 seconds before we ever started doing anything. The only time I wouldn't have them do that is if I was going to do an oral DNA test. During COVID especially, we love to nebulize ozonated water, but this is another way of getting ozone into the system and treating things locally in the upper respiratory tract. Ozone water is great to manage halitosis, the volatile sulfur compounds that get generated by the bacteria from sulfur-containing amino acids. You can put ozonated water in a heated irrigator. My only suggestion is make sure it's this type of irrigator where the water is heated just before it comes out the tip. If you heat the water in the container here, you're going to kill the ozone. We love ozonated ice sent home with patients following implant procedures, for instance. And you can also use it as preventive rinsing. It, again, removes the volatile sulfur compounds that start off the perio cascade. Something that hasn't quite hit the fan yet is what goes on inside our dental unit water lines. And that's all these bacteria tend to accumulate inside the very thin lumens of the water lines and just sit there hour after hour. So we run ozonated water through them. It totally cleans out those lines and eliminates that kind of contamination. Ozonated oils are another technology that we love to use that is very helpful for so many areas in dentistry. We call it ozone oil, but in point of fact, it's the ozonides that are in that oil. You take a classically organic oil like olive oil and bubble ozone gas through it. And when it reacts, it attacks the oil and turns it into these things. These are ozonides. And they're molecules that are in the oil now that can be applied to tissue, down into pockets, on lesions, etc., that have ozone-like properties. And they once they react on the surface, they essentially make ozone in a deliverable form. Ozone gas lasts literally for minutes at room temperature. But ozone oils can last for years and years, so we can put them in a little jar and have them applied anytime we want. You can actually make your own ozonated oils in the office, although we generally don't recommend you do that, but you can find places to purchase ozonated oils. And it has many, many applications, as you can see here. Here's a case of psoriasis in the hands of a dentist, where we put on some ozonated oil and gave him a handful of rubber gloves. Incidentally, ozone oil does not attack latex. And just have him go to bed with the ozone oil on his fingers. And in a few days, we basically got rid of the psoriatic lesions. Not suggesting, incidentally, that you do that, except for maybe yourself. You got to remember your scope of your licensure. It's very tempting to start doing all sorts of other things with ozone. We had a gal in the Northwest start treating people's fungal feet with ozone in her dental office. That didn't work out too well. So again, many uses for ozonated oils. We do use ozone gas along with other bleaching agents to bleach teeth. The main difference, I think the bleaching is a little bit more permanent and effective with ozone assistance. But the main thing is it's minus the zingers that we have seen classically with bleaching teeth in the office. Treating viral lesions like a papilloma. In the past, you know, we would cut these things out. Next thing you know, they'd be back even larger. Now with ozone, you just put a little cup over there, blast it with the ozone gas, it shrinks, and we get rid of these things pretty definitively for years and years. Notice the tissue is still a little funky looking, but there's no more virus within the tissue. We don't like that, we can do a little laser sculpting on it, but basically this is never going to enlarge now. Herpetic infections respond very well to ozone. In the matter of minutes, you can get them to start crusting over and feel tons better, and they'll heal much more rapidly. What's most interesting, let me back up one notch. What's most interesting with these lesions is about 25% of them never recur once we've treated them with ozone. Okay, now I know for your hygienists, you're all asking about perio. I treat perio and perio-implantitis the same, but basically we're dealing with the infections around the roots of the teeth there. I have a lot of problems, and I'm afraid I'm going to be a bit controversial here with our current methods of treating perio disease. And I think it's because we aren't really understanding where it's coming from. Yes, we're dealing with contaminated calculus on the surface of the roots. But let's say you, Miss Golden Hands, have now removed all of that calculus. The roots are supposedly smooth. Well, now all we've got here is the soft tissue loaded with bacteria. All we've got here is the root surface totally contaminated with bacteria and bacterial waste product, necrotic debris, slowly leaching out of the now exposed dental tubules. Well, thanks a lot. You think that's going to shut down inflammatory processes? Not automatically. So the dental tubules, you get like thousands of miles of dental tubules in a root. And when you scratch them up with our scalers, next thing you know, even more of them are open, and a good bunch of them are contaminated. This is what a cross-section of a tooth ought to look like. Gazillion little dental tubules there, but no bacteria. But in the case of an endotooth or a periotooth, they're quite identical. In the case of endo, the infection into the tubules comes from the inside out. In the case of perio, comes from the outside in. And when you open up these teeth, you find bacteria clear all the way down to the pulp. It should look like this, and this is what you can find. And let's say you even kill them, you still end up with a bunch of necrotic debris there. And as that leaches out of the exposed dentin surface, what do you think that's going to do to the inflammatory process? So I don't care even if you have it sterilized, as long as you still have inflammogenic debris coming out of those root surfaces, you've not shut down the inflammatory process. There they are, sitting there waving at you. If you look at the research, a good chunk of the bacteria of the teeth had bacteria clear down to the pulp in concentrations 259 to over 7,000 times compared to a healthy tooth. So radicular surfaces can serve as colony sources, and the infection will just recolonize with abundance. Okay, so how do we treat a deep perio pocket? First of all, we use ozonated water. Most times patients will rinse their mouth with ozonated water before they even put their butts in our chair. Then we'll squirt ozonated water in lots of different ways down into those pockets. You can use rounded end cannulae, side delivery cannulae, I like quite a bit. You can use a water pick to deliver it. You can attach these to a syringe. I don't care how you get the ozonated water down there, as long as you do, clear to the base of the pockets. So now we're squirting the ozonated water down into the pocket. Now you can accomplish your scaling in a much less contaminated zone. And generally, I'm going to really encourage you to use a Cavitron, a kind of Cavitron where you can put a little bottle here with high concentration ozonated water right onto the unit and squirt that along with your ultrasonic activity. I much prefer ultrasonics to hand scaling in almost every case. Generally, if we want to treat an entire arch, we'll use an ozone tray. You can have these made by a lab. There are simple ways to make them in the office. And so you put ozone in, it flows around the entire arch and comes back out the other side. And you can just bathe the teeth in ozone gas for a few minutes. You can buy these trays pre-made. And all of these procedures that I'm talking about are staff driven. Here, Aaron is delivering ozone by tray. The dentist simply says, please do this, or you decide you need to do it within your hygiene practice and get it done. It's not something that requires dentist time whatsoever. Application of ozone oil is very helpful. Ozone doesn't obviously last for more than a few milliseconds once applied to tissue, but ozone oils can last for hours. And so here we're using one of those little rubber tips. You don't get in some oil, usually put a little bit on the back of our hand and then scrub the oil down into a pocket. It takes literally seconds to accomplish that. Let's see. So here we're using a little different kind of a tool to, can you guys see the video?
Yes, we can, Bill.
Oh, good. So just very briefly, you scrape it down into the pocket and you're done. I would say they're spending much too much time doing that here. It takes one swipe and you're out of there. So some of this should take very little time within the course of your treatments. The other good news is once you start using ozone, your treatments are going to take a lot less time because you're not going to see the inflammation. You're not going to see the degree of calculus formation. We also have people reporting that ozonated oils incidentally soften calculus. So if you put the ozone oil on first, let it sit for a minute or two, you're going to find that getting the calculus off is much more rapid. And insufflation of the pockets, I think, is critical. I usually use about 30 seconds per pocket. So if you have 6 pockets around a tooth, that means a total of 3 minutes of ozone applied to that tooth. That means you're going to have to adjust the time. The good news is that you're not going to have to do this very often once you get the perio under control. And this is a very rapid, definitive way of managing the perio. So you're not going to have to be doing this every time you turn around. So here's the comprehensive hygiene visit. We'll pre-rinse with ozonated water, irrigate all pockets with ozone water prior to scaling, wipe instruments with ozonated water gauze between the pockets, use ozonated water in ultrasonics, gas all pockets that are deemed deep or problematic. And notice I have laser decontamination here in parens because it's rather rare to have to do anything with lasers anymore. And then ozone oils are applied by the practitioner. Often we'll send the ozone oils home for the patients to apply. I really like micro brushes for that. And the results are similar to laser treatments, obviously without anesthetics and much more comfortable for the patients to sit through. Where we have deep infections, we'll actually inject a small amount of ozone gas, low concentration, up into the soft tissue nearby. The vascularity carries the ozone down into the area of interest. This shows for a perio abscess, but even if you don't have an abscess, if you have active perio disease, I have no objection to putting a little ozone gas up near the infected tooth, because it's going to knock out the infection in the soft tissue and surrounding areas even more rapidly. And then healing is almost like instantaneous. We use ozone gas injections in many applications. Here's one for an endotooth, for instance. I don't like scalers much. I think if you're going to use scalers, I think they need to be exquisitely sharp. If you use a non-sharp scaler, this is what you're doing to the surface of the root. And that scoring makes it even easier for bacterial attachment and then formation of calculus, and calculus down in notches and holes where you can't even get to it with a normal scaler. So you want your scaler to be exquisitely sharp, at least, so that what you're doing to the root surface is at least traumatic. I do like these little sidekicks. I think every few strokes of your scaler, if you're going to be using a scaler, the scaler should be sharpened, or just have a whole handful of sharp scalers before you can start your procedure. But if you're using one scaler around the entire arch, I think you're maybe doing more damage than you need to. So here's a dramatic example of some of the changes that we can see with ozone. This is a tooth that in the past we would pretty much picked out with our fingers and taken out. But with the uses of ozone oils, gas, water, that bone can come back. So I wouldn't automatically write a lot of these teeth off. Yes, there are going to be some of these that you're not going to be able to save. But with proper application of ozone, a lot of them can in fact stick around. And this is rock solid and can stay for years now. Here's one from Fadi Sabah, an ozone dentist in Europe. This is pretty classic, nasty perio, and he used all of the techniques we just described. And this is the kind of healing you can see. Well, obviously you have some recession here. You're going to have to come to grips with that. But this is an aesthetic issue only. And in point of fact, I'm not even worried about deeper pockets. If they're not infected, if they're not contaminated, if they're not inflamed, for instance, that you can detect by bleeding on probing, I don't care if you have a deep pocket. It's not going anyplace if you keep things under control. Some of you may be familiar with the periscope. This is a great way to embarrass yourself if you're a hygienist. This is a little micro camera that is so tiny it can go down on essentially a probe the size of a scaler down into a pocket. And you can see what remains before you start, or after, even more embarrassing, after you think you're done. You scrape that root to your heart's content. It feels nice and glassy to your probe. And yet when you go look, you still see big blobs of calculus remaining there. And many of them sitting in lacunae that your scaler couldn't even reach into. I do like phase microscopy. I certainly would commend that to you. It's a very rapid way to get a sense of how a given area is doing. Take a little scraping out of the socket of the crevice around the tooth. You put it on a slide and look at it under the scope, and you can see what's going on there instantaneously. No long-term testing is needed. Probably spirochetes are about the worst. And this is the kind of thing you'll see under the phase microscope. Notice all these little single-celled critters are coordinating and streaming. They're all doing the wave to get poisons out and bring nutrients in. Here's one where somebody had used toothpaste 3 times a day, and you can see the amount of good it did. Loaded with spirochetes, See all the movement here. This active movement is a sign that you have very active, damaging old biofilm. As I say, I treat perio and implants rather similarly. Here's implants that you think you might be losing. Look at all the bone loss around there. But in point of fact, you can get a lot of the bone back if you apply the ozone in a variety of ways. Notice here we also polished off some of the flutes that are hard to keep clean, so that the bone was able to now come back undisturbed. Ozone oils are great for managing perio, as I mentioned. And I referred to halitosis earlier, that this is caused by volatile sulfur compounds that are remnants from proteins broken down by the various bacteria. Well, other than being stinky, these volatile sulfur compounds are very problematic. Here's a chart of the cytokines, all of the various biochemical reactions that go on in the periodontal pocket, for instance. So here we go. Volatile sulfur compounds coming in. And if you look at the bottom, way down here at the bottom, it mentions collagenases. Well, collagenases, as I hope you're aware, are collagen-eating enzymes, matrix metalloproteinases, that actually destroy soft tissue. Well, where are those coming from? It's not coming from the bacteria. You know, we blame the bacteria, but in point of fact, they may trigger this happening, but these MMPs are being generated by us. Our own body makes these collagen-eating enzymes, and that's what attacks the soft tissues. What about DNA probes, so we can get a sense of what kind of critters are roaming around? I don't think I would automatically do an oral DNA type scan on everybody, because if somebody comes in with bleeding pockets or obviously inflammation, I know what we're going to have to do. It's just an academic question of what kind of critters there are. But you do your thing with the ozone, and when you bring them back, you find that all these bacteria are below red line quite repeatedly.
I had it only on my phone.
I'm sorry?
Bill, I'm just going to interject for a second and ask
Yes.
everybody please to mute themselves, because there are a few people that are still unmuted. Thank you.
Oh.
That's what's happening.
Well, there's several versions now. You got oral DNA and a newer one that looks at fewer bacteria, but rather well, is the HR5 from Direct Diagnostics. I would commend to you. When you think you're done, when let's say a 25-year-old woman comes in and you pat yourself on the back, everything looks great, you don't have any more bleeding on probing, you don't see any of the redness, et cetera, et cetera, et cetera, you think you're done. Well, that's a good time to run a DNA scan and see what's roaming around in there, because it may just be you've temporarily controlled things, and if you don't knock out that biofilm, you're going to have a recursion of your periodontal attack. So this is a good time to use an oral DNA scan. And obviously, the first thing I would do is a phase scope, because if I see nasty things in the phase scope, I don't even need to do an oral DNA. I do have some reservations about some of the reports that we get from oral DNA. They do make some recommendations, for instance, about antibiotics. Well, first of all, I'm not particularly thrilled with systemic antibiotics in perio to begin with, because I think it's a local problem that we ought to treat more locally first. And secondarily, the recommendations are generic recommendations. So they see, for instance, Tannerella forsythia, let's say. There's a certain antibiotic that normally works on Tannerella, but it doesn't tell you a thing about what it's going to do on the kind of population of Tannerella that you particularly have in your biofilm. So even though it may be appropriate generically for most Tannerellas, we don't know for sure what it's going to work on for you. Generally, I would manage things locally with ozone first. If I wasn't successful, then I would consider antibiotics. And part of the problem is that at least 40% of the bugs in perio are not bacteria, they're fungi. And in point of fact, a lot of them are viruses, especially early on. Jorgen Slotz, for instance, shows that the initial attack very often is viral first. That changes the body's mechanisms of its immune system, that shuts down our ability to fight off bacteria. And then the bacteria get going. So first of all, we should be looking at viruses, and nothing that I'm aware of even does that. So ozone doesn't care. It's going to kill you if you're a virus, a fungi, or a bacteria. One other thing you might consider doing, and this is a one-time off for your patients, is a Celsus 1 probe. You can get that from oral DNA. And that gives us a sense of the potential for overreaction. And what do I mean by this? Well, remember I showed you the bottom of the cytokine cascade, the production of collagen-eating enzymes, MMPs. Well, certain genotypes are much more likely to overreact and make a bunch of MMPs, and other genotypes don't care so much. So if you want to know your patient's predilection for having a perio attack, the Celsus 1 probe will give you a good sense of what's there to begin with. And those who have certain characteristics there are ones you're going to have to watch more carefully and closely. Yes, you can get insurance coverage for some of this if that's a concern. Usually it's called application of an antimicrobial. Let's take a real quick look at ozone in medicine. For instance, here's a diabetic foot being treated in Brazil. The lesion that you're seeing here, incidentally, is probably smaller than what you would see if you added up all of the infected raw tissue in a perio disease-ridden mouth. That's probably about the size of your palm or the size of the inside of your forearm. But we don't even think about it. Physicians don't even care about it because it's out of sight, out of mind. Well, this is after 92 sessions of ozone application. Ozone water, ozone gas by bagging, ozone oils. Took 92 sessions to get this back. But this is going to be a diabetic who's not going to lose a foot. Healing is quite complete, but this is after 120 sessions. Well, the good news is after 1 or 2 sessions in the mouth, we can accomplish the same thing. Things heal over remarkably rapidly in the mouth. Lots of other applications. Here's a case of an AIDS patient. You can see all these little fungations on the inside of his cheeks. We're getting very nasty for him. We filled the mouth with ozone gas, and that totally diminished the amount of attack that he was experiencing. Great for endo if you're going to do endo. I'm not a grand fan of endodontics. I think if you're going to do endo, the only way to do it is with ozone. I do like some of the light walker lasers as well, but if you're going to just do classical endo, I'd rather see the tooth taken out. And here's one of the reasons why. Look at these communications here. How the heck are you supposed to clean those with a conventional endo file? How are you supposed to get into some of these things? The kind of things they showed us in dental school were just these nice, round, smooth, pencil point shaped root canals. Well, that's just not reality. Okay, so let's presume that we can clean every one of these perfectly. Lord knows how, but let's presume you could. Now, you still have 30,000 miles of dental tubules that are sitting there contaminated, leaching out into the surrounding tissue. So I'm very skeptical about our conventional endo techniques. I think if you're going to do endo, it should be with ozone, and you can percolate the ozone down in there and just not only get rid of the active infection, but the necrotic debris, which is inflammatory as well. This is reality in endo. And so if we're going to be serious about it, we've got to do better than we've been doing before. Exact same pictures. bacteria and their waste products, necrotic debris inside the dental tubules. Necrotic debris, the bacteria get in there, they kill off the dental process that comes out from the pulp, and next thing you know, you have dead tissue in there. Ozone's great for aphthous ulcers and makes them feel better almost instantly and heal much more rapidly. We do injections at trigger points for headaches, into joints. Ozone, incidentally, if you're going to use anesthetics, is great for removing that anesthetic, particularly if you're going to be working on kids. We put in a little bit of ozone gas right where we put the anesthetic, and the anesthetic is gone almost instantly. This is called ear insufflation, where the ozone gas is put into the ear canals. Another way of getting ozone, especially into the head and neck, right next to the TMJ. Another technology is inhalation of ozonides, where we bubble ozone gas through oils. He's not breathing any ozone. He's breathing ozonides that bubble up out of the oil that you see here. And that can get into the body. It's great for instance, for head and neck infections, sinus infections. We used it a lot during COVID, for instance. Systemic and local application of ozone can happen through any mucosal surface. A good exposed mucosal surface is the floor of the mouth. So here, this is a tray that fits under the tongue. The ozone gas comes in, passes over the mucosal tissue, which is highly vascular, and then is sucked back out again. So you get a good amount of ozone into the entire head and neck, and then into the entire rest of the body. I think this is better than ear insufflation, but it's a little bit more complicated to accomplish. Yes, you can put ozone directly in the mouth, but it's got to be done with great care, because you sure as heck don't want somebody to be inhaling that ozone. Let's talk real quick about some skin rejuvenation using ozone. This is before and after. To me, it looks like it's taken about 25 years off of this poor gal's face. And this is using ozone oils, ozone gas, and ozone soaps to provide change and rejuvenation of the skin there. The oils can be incorporated into soaps, and we have seen some nice results for acne and rosacea, for instance, with these ozone oil soap. So ozone oil soap can treat problematic areas. They can also be used to prevent more rapid aging of the skin. Let me commend, I'm almost done. Let me commend the ZT4BG to you guys. That's zerotoleranceforbleedinggums.com. That's a source for some of the impetus for your patients to follow up on the oral systemic concerns. And it's also a separate resource for you to look at some of the research that's come through on the oral systemic connections. ZT4BG.com. Yes, we picketed our local newspaper about all this. I hope you're all members of AOSH. If you're not, you can go to aosh.org, American Academy for Oral Systemic Health. That will help you integrate the entire body into your perio practice. We do have a pretty active ozone discussion group online every night. We're talking back and forth. You're more than welcome to join us. It's free. If you're interested in participating, just contact me at wmdomb@verizon.net, and we'll get you hooked up. You can ask any kind of questions you like. I hope what we've talked about is a stimulus enough for you to pursue this further. Yes, ozone is good to help your practice grow. It's hard to stand out these days in a crowd, but ozone is one of the things that will help people talk about your practice. Yeah, okay, ozone's great, but there's a limit to the miracles it can perform. But it's amazing to me how many things we're able to accomplish that we weren't able to accomplish before as well. So please do stay in touch. There's my phone number, there's my email address. And again, I think that's located also in the chat. I'm happy to take questions anytime.
I have a question.
Fire.
Okay. My name is Amanda. And so if you're treating an aphthous ulcer, do you flow the gas over the ulcer, or are you using an ozonated oil? What are you doing to just immediately treat
Both.
that?
You can wipe it down with ozonated water to take any kind of debris off to make it a little bit more accessible. I keep that to a minimum. There are various size cups that you can decide to use. Some people have devised other larger cups for larger surface lesions. And then it's about 30 to 60 seconds on the lesion. Once that's done, you can give the patient some oils to apply during the day when they're home. But really, it's the gas that's going to make the biggest difference there. You can expect it to crust over in the day and be very comfortable almost immediately.
Awesome. I have one more question, I think. If you're introducing the gas into the pocket depth, when you are hooking that up, are you running it through the water or the oil, like for ear or nasal, or are you doing it
Just the
directly to the
max
machine?
I would use max concentration gas. Either you can attach the cannula to a syringe. I generally would prefer to have it come directly off my generator. We rig it up in such a way that we have a solenoid trigger on the oxygen bottle, so you can use a foot control or a wireless controller and turn the gas on and off as you go around the mouth. You don't need multiple people to be doing this. You can do this by yourself.
Okay, thank you.
Hi, Bill. This is Joy Horn. Thanks for the great presentation. It was wonderful. I was curious about the name of the water purifier you had a slide on for about $200.
Well, okay. I'm glad to tell you it's an alley. There are lots of different ones of that ilk around, maybe $1,200, $200. But well, I'm not going to encourage you to go out and buy an ozone generator. I think you need some degree of hand-holding and training. Yes, you can do some damage with ozone. It's a little bit dangerous. And there are many, many ancillary things that we've not really talked about. So when I take an office that wants to do this seriously, it usually takes 2 full days of didactics and practical stuff. And then a third day of clinical coaching, over the shoulder type coaching, to have them adequately up to speed. We used to do public courses and have people go home with a big box of equipment. But I found that people are not as well prepared to actually get up and running doing that. So we'll go into an office and get them going with private consultation now. The other reason is FDA was joining us at our courses and being a pain in the ass. So I don't do public courses anymore.
Okay, great. Yeah, because I was looking at a certification course in Nevada.
Who's doing that?
Began with an S. Frederick Schlesinger or
Schellenberger. No.
Schellenberger, yeah.
Well, unless you're an MD, you don't want to be taking that course.
Okay.
That would be more of an advanced course, and I think some of that will be of interest. And the reason I'm saying that his focus is more on systemic ozone.
Okay.
With major autohemotherapy, for instance. I do think that ultimately we're going to see hygienists doing major autohemotherapy of one sort or another, or a direct IV, even easier, where you put some ozone gas directly into the vein. But I would call that an advanced study module and not usually part of the initial training.
Okay. Well, my last question, I don't want to take up time for other questions. I did purchase an ozone unit for my personal use through my functional medicine physician. And if I had that and had some of your hands-on training, do you feel that would be adequate?
Sure.
Okay.
What are you using it for, may I ask?
I'm just using it for my own purposes, drinking water, making my own water. I do some ear insufflation for
Oh, great.
myself, those sorts of things. Mhm.
Uh-huh.
Yeah.
And how are you controlling the ozone exposure, like when you're doing ear insufflation?
It's got a escape filter that's attached to one of the leads.
Is it a 2-lead system?
Yeah. Mhm. Yeah.
Does it go into suction or something?
It actually looks like a filter that you turn on and off when
Hmm.
you're generating it.
No, I'd be curious to see. Why don't you communicate with me privately? I'm curious what it is you're using.
Okay, will do, will do. I'll send you that info. Thanks.
Hmm. Yeah, interesting.
Great. Thank you.
And this is, you say it's from your naturopath?
Functional medicine?
Function metal. Medicine.
Yep. Hmm.
I'm glad to hear that they're starting to wake up.
Yeah, yeah. I am
There are
too.
lots of other ways of getting ozone into the system. I didn't talk, for instance, about rectal insufflation. A lot of MDs are recommending that. I
Yeah.
don't think I'd practice that within the dental office, but
No.
in point of fact, some offices actually put the ozone in a bag, and the patients go home and do it.
Go home and do it. Nice, nice. Yeah, and then the Pure O3 has a lot of different products from,
Yes,
yeah, just
and
great.
they have some good training modules as well.
Yeah. Hmm. Great.
But
Thank
there's so many dramatic impacts in a dental office. I think the entire office needs to be up to speed on using ozone, so everybody's on the same page, because there's so many profound areas that it can really impact.
Yeah, I agree.
All right, we've timed out.
Thanks.
I've got one last question. If
Go ahead.
With, so I work at a biological office, and so we utilize ozone. It's in our Cavitron.
Great.
We do purchase oils. My question is, it's a little unclear. How long is the longevity of the potency of when we make the ozonated water? What's it good for? Or if we crack a bottle of ozone oil, what's the
Okay, two very different items. Ozonated water has a half-life that's relatively short, maybe 15 minutes. Not sure how you're making your ozonated water. If it's at room temperature, it's just barely strong enough for therapeutic use. So you want to be using it instantaneously for every patient you refill your Cavitron. On the other hand, if it's just a control, for instance, the biofilm in your dental unit water lines, that can last an entire morning. So usually we'll fill up maybe a third of the bottle with high concentration ozonated water and the rest with water, and then change it when we come back in the afternoon. Ozonated oils vary. Many of them can last many years if they're not abused. Like wouldn't want to put it in a hot car, for instance. But you don't need to refrigerate them. On the other hand, there are a variety of oils being sold these days of variable quality. So you need to be a little careful where you're getting your ozonated oils. If they're not dried before you ozonate them, you end up with a bunch of water in the system that makes a bunch of acids and aldehydes that makes them more irritating. And maybe they're okay to use on surface lesions, but I wouldn't want to get them deep into my body under those circumstances. So a reputably made oil has to be dried very thoroughly prior to ozonation, and then handled with a certain degree of care throughout the entire process. For instance, it needs to be kept cool while you're ozonating things.
Great, thank you.
I did mention you can make your own ozonated oil in the office. I generally don't recommend it. You want to do it. If you're going to do it in very small quantities. But I showed you that flask where people were inhaling ozonides. Well, that system is making ozonated oils in the process of inhaling those ozonides over time.
Bill, can you talk about Herxheimer reactions?
Okay. Familiar with toxic shock when somebody has had a Tampax in for too long? What happens is the bacteria then die. So then now you have a whole bunch of lysed bacterial pieces floating around the body, and they cause inflammatory reactions. You may break out on the skin with red blotches or go into cardiac arrest. I mean, lots of different inflammatory effects can occur. That's a Herxheimer's reaction when you killed off too many bacteria too fast, and now you have to deal with the consequences of all of the dead pieces. Incidentally, somebody has said, I'm allergic to ozone. That's complete hogwash. You can't be allergic to ozone, you're going to be dead, because that's what your white cells use to work on bacteria. So if somebody's had a reaction when they've been exposed to ozone, most likely it's a Herxheimer's reaction.
Thank you. Excellent. Is there anything we can do to help a patient if they're having a Herxheimer reaction?
Probably steroids by mouth and a little pat on the back and tell them it's going to be gone fairly soon.
Okay.
And it's understanding what's going on. They're extremely rare, and in dentistry, we just basically never see them. If we see them at all, it's doing the heavy-duty systemic applications that I talked about in medicine. You can get paranoid about all sorts of stuff, but in dentistry, ozone is a very low-key option if you pay attention to what you're doing.
Okay.
About the worst I've seen is somebody coughing for a bit because somebody didn't pay attention to what they were doing. But that's about the size of it. It's hard to do too much ozone. You can waste your time applying ozone, like to a cavity. You just don't need to do it for 5 minutes. 30 seconds is usually plenty. You can't do too much ozone by and large.
Okay.
I have a question. This is Tracy. We don't have ozonated water as a pre-rinse. So could you recommend if ozonated or the ozonide oils as a pre-rinse instead? And is
No,
it as effective?
I wouldn't. It's hard to get them where you need to get them. And they taste pretty nasty if you have to use that much of them. If you're going to apply oil, you want it to be an absolute minimum amount. Like when we send our patients home with ozonated oils, we'll usually use the micro brushes like from TP. You have them swipe that brush through the oil once. That little bit of oil that's on that micro brush is enough to do an entire arch. But I think you're going to find some pushback from your patients if you have them use a whole bunch of oils, because they do taste fairly nasty. It's, as we say, an acquired taste. Hang on a sec. I can't hear you.
How to make the water?
Yeah, oh, sure. I mean, my wife Ellen is saying, make your water. Make the water. But everybody here is at different stages. I'm thrilled to hear that some offices are already using ozone. That's great.
All right, Bill, Amanda had a question about any contraindications for insufflation with pregnancy.
Don't get pregnant. Oh. No, I wouldn't say so. Systemic, I would have a little bit concerns about, only because of medical legal concerns. In point of fact, having some ozone during pregnancy, I think is a very good idea. If I were pregnant, I would do it, because I think you improve the risks against preterm low birth weight babies. But unless you're talking about heavy duty systemic exposures, which I think is fairly unlikely for most dental offices, I can't conceive of it being an issue. You know, if you want to limit yourself, just use it during the middle trimester, but I think it's a bit silly. Also, I did mention that there are some OSHA standards about what you should be exposed to. You need to pay attention to that in the office. If you're spilling ozone, you got to figure out where it's coming from. and deal with it accordingly. In our courses, we talk about lots of different troubleshooting techniques, for instance, to understand how to figure out where the smell is coming from. You don't want to be smelling it yourself to any degree.
Right, and Catherine had a question about benefits for trigeminal neuralgia, TMJ, facial and ear
Yeah,
pain.
well, there are lots of things I would do in those cases. First, I would start with ear insufflation because it's so close to those structures. That's so simple and it works a good chunk of the time. If that doesn't work, then I would consider injections, and there are two major sets of injections. One is in the inside of the mouth, kind of like a high akinosi approach, where you squirt some gas up toward the TMJ. And then I showed you some pictures of us injecting the gas from the outside of the mouth in front of the ear right into the capsule of the joint. But it's actually fairly rare to do that because the other things I mentioned are so effective. Most of the time, you don't have to get to that point.
Okay, thank you.
Ear
All right.
insufflation for that kind of a situation, probably 15-minute sessions twice a week initially in the acute phase, and then cut back.
All right, and Mary Kay asked about benefits for tinnitus.
Similar, you're not going to take care of all of them. We've had some dramatic success with some cases. Some have required chronic exposures, like every week for certain patients for 6 months. Most are relatively short, 15 minutes and you're done with it, or 15 minutes for a couple weeks and you're done. But I
And
sure
what
would be cautious about making promises. We don't know exactly how people are going to respond. Good news is most of the things you do with ozone aren't going to make the problems worse.
And Jody asked what gamma and time for the tinnitus.
If I'm doing ear insufflation, I would use max concentration you can make, about 15 minutes. Other people do not do that. Other people use lower concentrations.
And Jennifer asked, can you recommend any companies or people that would come to the office to train?
I will do it. Eric Zaremski will do it. If you get in touch with me, I can put you in touch with them. There are some public courses being done by Malika and Harris. However, I have a few reservations about that approach. The material in the course is good, but when you're done, you don't have any equipment. So now you've got to go home and source all of the equipment. And by the time a couple of months is over, everything is kind of evaporated out of your poor brain. So my approach would be to have everything in the office before you even start training, all of the equipment, so you're ready to hit the ground running and immediately start using the equipment. And I think that's Eric's approach as well. We do have a couple other instructors who work with me. Dan Kinkella up in Canada, for instance, David Hamill down here. So there are ways to get you training. But easiest to just contact me and I'll aim you in the right direction.
All right, any other questions? All right.
Thank you all for
Very
participating.
good.
Stay in touch.
Thank you, Bill. Thank you, thank
bet.
you.
Thank
All
you.
right.
Take care.
Okay.
Bye-bye.
Bye-bye, Bill. All right, everybody. Thank you all. I need a couple of names. There's somebody with an iPad and a Zoom user. I don't know who you are. So if you could, and I can post Bill's email. It is William Domb, D-O-M-B, at Verizon. Let's see. Hold on.
Barbara, I posted it in the chat for everybody.
Okay. Oh, thank you. All right, I'll post it again because there you go. All right. And yes, Melissa, I did get you. Excellent. All right, I want for you to get CE credit, just message Kim Smith. I think it's kim.smith@IAOMT.com. And if you have any problems, email me and I will get you that CE and iPad. I don't know who you are, so message me and so that I can make sure you get your core CE credits. And next month we'll be doing airway. So it will be, I think that's January 7th, same time, same station. So thank you all. It was great to see all of you. We had 23 people come in today. So yay. I am so happy to see all of you. And any questions, email me. I love Ozone. I can talk about it just as long as Bill. And it is a great addition. It should be part of our armamentarium. When I first learned about Ozone, it's like, why isn't this standard? It just should be part of everything. So, all right, everybody, you have a great Christmas holiday, and I look forward to seeing all of you next month.